and we just want to present a case. Jaidas garu, 72 years old, admitted to the hospital under a neurology, but later on they transferred the case to orthopedic that he is having a shoulder pain after stabilizing the neurology. So we examined him and there was swelling, and we sent him for X-rays. X-rays was a bad comminuted proximal humerus fracture. We advised him a CT scan where it was a shattered proximal humerus fracture, and we also advised him an MRI scan to see for the cuff. After explaining him like going for a osteosynthesis or a fixing with a plate or go for a reverse shoulder arthroplasty, which is like a not routine surgery, at least in these areas. They agreed for a reverse shoulder. Then comes the challenging part.
So actually the patient presented with a syncopal attack, and when we evaluated, we found a carotid bulb calcification and also a medial intimal thickening. So considering all this, putting him into GA for long 3 to 4 hours and bringing him back from the general anesthesia will pose him a risk to the severe risk peri-op. So regional anesthesia has an advantage of peri-op analgesia with anesthesia, but considering the relaxation part which the surgeon requires in some steps, reduction and implant fixation and all, we have maintained the plane of depth of anesthesia with slight sedation using propofol and all, which made the job of the surgeon very easy.
We planned meticulously and we have ordered reverse shoulder implants. After going inside, like there was a shattered pieces of shoulder. So at that moment we decided that it was a nice decision to go for a reverse shoulder replacement than for a osteosynthesis. Procedure went on around 2.5-3 hours. He thoroughly cooperated throughout the 3 hours, and luckily surgery went on very smooth. He is comfortably sitting with us to give his testimonial for that.
मैं जो यहाँ आया था मुझे कुछ नहीं मालूम था हॉस्पिटल में कैसे आया। यहाँ पे आने के बाद ये टीम हमारा जो डॉक्टर्स टीम है ना बहुत अच्छे लोग हैं और अच्छा ट्रीट किया है और मेरे को कोई प्रॉब्लम भी नहीं होने दिया। एक साइड में अनकॉन्शियस था हाथ का, बाकी जो ये लोग कर रहे थे हथौड़ी मारना और नट बोल्ट स्क्रू में टाइट करना, ये सारी चीज़ें मैं सुन रहा था अच्छे तरह से। ये सारा करने के बाद टीम अच्छा था, इसलिए मैं अच्छी तरह सर्वे करके अच्छी तरह यहाँ बैठा हूँ। आप जो बुजुर्ग लोग हैं आगे भी किसी को ऐसा प्रॉब्लम हुआ तो कि कंसल्ट कर सकते हैं इस हॉस्पिटल को, ताकि टीम अच्छा है। इसलिए मैं भी बताना चाहता हूँ उन सब के लिए ताकि वो आके यहाँ पे ट्रीटमेंट कर ले।
My message to the elderly population where you have a consideration ki going for a osteosynthesis or a reverse shoulder, keeping in view of regional anesthesia, we have a good team of regional anesthetists here. I encourage the elderly population to think on a reverse shoulder side where we can't go and fix those